Unlisted patient in St. Mary Hospital. The night shift at St. Mary Hospital was usually uneventful. Nurse Claire Dalton had worked there for nearly a decade, and most nights followed the same rhythm, monitoring vitals, adjusting IVs, and making rounds through the dimly lit hallways. But tonight something was off. It started with an entry in the system. A patient, admitted at 11:42 p.m. No name, no ID, just a bed number, room 306. Claire frowned. Normally, all patients required registration, insurance details, next of kin, a full medical history. But this entry was sparse, almost as if someone had deliberately kept it that way. Curious, Claire checked the security footage. The camera outside room 306 showed two orderlies wheeling in a gurney covered by a white sheet. The patient's face was obscured. No doctors accompanied them, no nurses signed the paperwork. It was as if this person had materialized out of thin air. When Claire finally gathered the courage to check the room, she found something even more unsettling. The bed was empty. No patient. No signs that anyone had ever been there. The logical explanation would have been a clerical error. But Claire couldn't shake the feeling that something was wrong. She called down to the admissions desk. "Hey Jennifer. Do we have a record for the patient in 306? There was a pause. 306? That room's been empty for weeks. Are you sure? I saw an entry in the system. Someone was admitted at 11:42 p.m. Jennifer hesitated. Hold on. Claire heard the rapid clicking of a keyboard, then silence. That's strange. There's no record of an admission at that time. In fact, the system says no new patients were entered after 10 p.m. Claire's hands grew cold. I saw the name pop up in the system. I even checked the security feed. Two orderlies wheeled someone in. More clicking. Then Jennifer's voice dropped to a whisper. Claire, the logs say no one accessed room 306 tonight. And the last security footage entry for that hallway was 3 days ago. Claire's stomach twisted. If that was true, what had she just seen? Determined to get answers, Claire decided to dig deeper. She checked the hospital's digital logs, searching for anything unusual. That's when she found it, an override code used at 11:42 p.m., the same time the patient had been admitted. The override bypassed standard procedures, allowing someone to manually enter a patient without leaving a digital trace. Someone inside the hospital had done this deliberately. Claire's heart pounded as she scanned the override logs. The code had been used once before, exactly 1 year ago for another unlisted patient. She needed to find Dr. Matheson. Dr. Matheson was one of the oldest physicians at St. Mary, a man who had been there so long that some joked he had been grandfathered in when the hospital was built. If anyone knew about strange hospital practices, it was him. She found him in his office, sipping stale coffee. Dr. Matheson, do you know anything about room 306? The old doctor stiffened. Why do you ask? I saw an unlisted patient admitted there tonight, but there's no record of it. I checked the system and there was an override code used, the same one from a year ago. What's going on? Dr. Matheson sighed and set down his cup. There are things in this hospital you don't want to know, Claire. But I already do, she insisted. Please tell me. The doctor hesitated, then finally spoke. 20 years ago, St. Mary had a special ward, the North Wing. It was for experimental treatments. Patients who didn't officially exist. The program was shut down, but some cases never left. Claire's blood ran cold. Are you saying someone is still running those experiments? Matheson leaned in. All I know is that every year on this exact night, a patient arrives. And by morning, they're gone. Claire knew she had to go back to room 306. But this time she wasn't going alone. She enlisted Paul, a security guard she trusted, and together they made their way up to the third floor. The hallway was eerily silent. The flickering fluorescent lights cast long shadows, making the atmosphere feel even more unsettling. When they pushed open the door to 306, they both froze. The bed was no longer empty. A figure sat upright, staring directly at them. A frail man wrapped in hospital sheets, his skin almost translucent. His eyes, sunken but intense, locked onto Claire's. "You see me?" he rasped. "That means it's too late." Claire's breath hitched. "Who are you?" The man shook his head. "Not who, but what." Paul reached for his radio. "We need a doctor in?" "No." The man's voice cracked. "They can't know you found me." Claire knelt beside him. "Please tell me what's happening." His lips trembled. "I was patient 0. The first one. They said they were curing us, but we were experiments." His breathing grew ragged. "Every year they take one more. To keep the others quiet. To keep the secret buried." A sudden knock on the door made Claire jump. "Claire?" a voice called. It was Dr. Matheson. "Open the door. Now." Chapter 5. The Disappearance. Claire hesitated. The man in the bed shook his head desperately. "Don't trust him," he whispered. Paul exchanged a look with Claire. But before they could react, the room was plunged into darkness. A metallic click. The unmistakable sound of a syringe being uncapped. A groan. Then silence. When the emergency lights flickered on, the bed was empty. The patient was gone. Dr. Matheson stood in the doorway, his face unreadable. Behind him, 2 orderlies, the same ones from the security footage, lowered an empty gurney. "You shouldn't have seen this," Matheson said. Claire's pulse pounded. "What did you do to him?" Matheson sighed. "You don't understand, Claire. He was never supposed to be here. And neither are you." Paul grabbed Claire's arm. "We need to go. Now." But before they could take another step, the orderlies moved in, blocking their escape. Matheson's voice was calm, almost regretful. "I need you both to forget this. For your own good." Claire and Paul never spoke of that night again. By morning, room 306 was empty. The records had been wiped clean. The security footage showed nothing unusual. It was as if the unlisted patient had never existed. Claire handed in her resignation a week later. Paul followed soon after. They both knew that St. Mary Hospital held secrets they weren't meant to uncover. But sometimes, late at night, Claire still thought about the patient's final words. "Every year they take one more." And she couldn't help but wonder, who would be next?